It's time for another episode of Chillie Chats, where we interview folks from the travel and cruise industry world. To introduce today's guest, here's our host, Chillie Falls.
Good morning. My guest this morning on Chillie Chats is Dr. David Smith of Access Healthcare. Dr. David is a graduate of the Medical College of Virginia, and for about 30 years has not only been my friend, but my doctor. So with no further ado, I will introduce Dr. David Smith. Dr. David, how are we doing this morning?
Good morning, Chillie. I'm doing great. Hope you are too.
Okay, that's good. We might have a little delay between us, but so we'll make the best out of that one. My first question for Dr. David is with the state of Virginia opening the economy today somewhat, and many other states across the country doing the same in this period. For senior citizens like me that have been sheltering in place, what's your thoughts about how long we need to stay sheltered in place?
Chillie, I think, this is a question that to which the answer changes day by day. I think there is no question but that people who are older and people who've got, chronic medical conditions, diabetes, obesity, lung disease, etc., are at substantially higher risks than a lot of the rest of the population. I don't think at this point in our community, which has got very low penetration, that senior citizens have to stay locked up, never to come out the front door, never to enjoy some of the better things in life. But I think they still need to take more precautions than the rest of the community. I think being outdoors is a good idea. And, pretty clearly it's been shown that that's probably about the safest place you can be. I think you should be out and around. But I think as a senior citizen and as somebody with some higher risk factors, you need to pick your spots. I would not be going to crowded areas. And I think you probably should still stay out of the Lowe's and the Home Depots of the world as much as you can. And if you are in, public exposure, I think wearing a face mask is still a good idea. I think you should do that. But I don't think you need to be like the little lady that I talked to a couple of days ago who had not come out of her house in more than 2 months. I think it's time to come out.
Well, I've not done much more than that. I've been to the dentist twice, and I went to the bank yesterday to deposit my income tax refund check. Other than that, of course, I do go outside. Right. One of the things that I miss tremendously is the Y, and I assume the Y is going to be opening under some kind of circumstances in the next few days or weeks. I'm not sure how that fits into the governor's protocol. What do you recommend for exercise when you're basically sheltered in place?
They have some great inventions. They're called shoes and coats. There isn't any reason why you can't be walking outdoors. And walking is probably the best exercise there is in a lot of ways. So even if you can't go to a gym, even if you can't go to the Y, and by the way, they're talking about opening those things soon.
Yeah.
As a high-risk person, there isn't any reason why you can't be, out walking around on green grass.
Okay. One of the things that there's a lot of debate over is testing. Are you at the point with your practice that if I come in and I'm showing symptoms, can you test me for COVID-19?
So there's really two kinds of testing that is available today. The first of which is to actually test for the presence of the virus, to test for the protein of the virus. That's done with either a nasal swab or the latest technology is going to be with saliva, so you can sort of spit in the cup and do it. This is something that we do have in our office that's available. At the moment, the version of it that we have requires probably an overnight wait time before we get the results back. And we've done this. We've had a couple of positive COVID patients in the last 2 months. The other kind of testing is antibody testing, which is widely talked about in the news and controversial. The reliability of this is still in question, depending on which test is being employed. But that's a test, and that picks up antibodies that your body may have made to having had the COVID infection, and it can predict, whether somebody has developed immunity. We are also doing that. That's a rapid antibody test that can be done in 10 minutes in the office. And what I tell people is that if it comes back positive and it looks like you have antibodies present, then likely you have had the coronavirus and likely you are immune. Where it's more iffy is if the test comes back negative, is that in fact a reliable test, and does that mean that you've never been exposed to the virus? And opinions vary about these tests right now.
All right. One further question before I get to the big question that much of my audience wants to hear an answer to. This fall, I come in for my annual flu shot. Does that help at all with COVID-19? Or do we not know?
Nope. Doesn't have anything to do with COVID-19. Now, the only conceivable connection would be is that if somebody has chronic lung disease and is sick with influenza already, would that make them immunologically more at risk if they were to get the COVID virus? But they're two completely different infections and they're not related.
Okay. So what that means is before it's over with, you're going to end up sticking me twice a year, once for the flu and once for this stuff.
That's it.
All right. Now, the big question, Dr. David, knowing my history, and by the way, my audience knows my history too. They know my obesity. They know my lung complications. I come to you and say, okay, Dr. David, I want to go on a cruise again. What do you think? What's your answer going to be?
It looks like we have clearly identified that activities where around a lot of people, make the virus spread more easily. And we've certainly had enough contagion on the cruise industry so that the whole thing is shut down right now.
Yeah.
Now, when you think of the millions of dollars that are, being lost, the cruise industry is very interested in coming up with a means of creating an environment that's safe for you to cruise. There's all kinds of conversations. Will there be testing to demonstrate that you are free of the virus before you get on the ship? Can they create a more safe environment in the ship with better protocols for cleaning and sterilization and so on? I think it's fair to say the cruise industry is not open yet and isn't ready to open yet.
Right.
Now, when it does, I suspect there are going to be a lot of safeguards in place that we haven't seen before. That would make me feel more comfortable about somebody who's young and healthy being on a cruise. It would still give me a little pause about somebody who, has a set of risk factors like we may have just referenced.
Right.
But I think the time is going to come in the not too distant future when there's going to be a comfort level for everybody going on a cruise. It's just a question of when we get things worked out. Now, is there going to be a vaccine, and are we going to have that this fall? And, who knows for sure. So it's a one day at a time process.
Well, Dr. David,
Chillie,
I certainly do appreciate.
I guess I would ask no, I don't think you should get on a cruise ship today.
Yeah, I agree with you.
I say I don't think you should get on a cruise ship today, Chillie.
Yeah. at least, Dr. David, you didn't give me any really bad news. That's great. I want to take this opportunity to thank you for your time this morning. I do appreciate it. And thanks for the wonderful advice for my audience. And we'll talk to you real soon. Dr. David Smith of Access Healthcare.
Chillie, thank you.
And
Thank you for watching today's chat. We hope you will join us next time as we discuss various facets of the travel and cruise industry. Chillie Chats is a production of Chillie's Cruises and hosted by Chillie Falls.